We were inspired to be able to allow every person to have the smile that they truly are comfortable with, that they love, and that they feel proud of. And we've dedicated our practice to this area because we grew up in this area and we feel that everyone in the community needs a spot where they can be able to find a dental home, and that we are their dental team and their dental family to provide them whatever they need and guide them in the right path so that they can have overall health, not just dental health. Our initial new patient exam does reserve 90 minutes to allow our team to get to know our patients. Every patient has a story, where they've been, where they are now, and where they want to be in their dental health. It takes that time to be able to gather that history so that our team can be able to work with the patient to devise a game plan that works for them to get them ultimately to their goals in their dental health. And that initial appointment really allows the entire team to gather all the necessary records, do a wellness scan, and be able to really work with the patient and give a game plan to meet them where they're at, and at the end of the day, give them their overall dental health. The Pankey approach is basically treating the patient as an overall patient. Again, we never see a set of teeth walk in the door. We're seeing the person that has concerns about not just their dental health, but really how that integrates with their overall health. It's called integrative dental medicine. So we really treat the patient as a whole, and seeing that whatever dental issues they have, we want to treat that dental issue as a part of their overall health. And then again, customizing their game plan to be able to give them their best outcome on their terms. We're able to do high touch, high end dentistry, but also be able to meet the patient where they are. Every patient has their own journey, whether they want everything done at the same time or they need to be able to take small steps. And so we always refer to our team as we are the GPS, and the patient wants to give us directions to their path. And so we always allow the patient to guide us to how fast or how slow they want to get to their journey. And that's what we're here for, is to be able to be their co-pilot in their dental health. The biggest difference that most patients tell us is the education. I've never been told that before. No one's ever, explained it like that for me. And education is super important, because once you know that information, you're able to make the right decision for yourself and for your dental health and for your overall health. If patients are more aware of their condition, they're able to make better decisions for themselves. So education is a big overall response for most of our patients. Like, I've never been told this, or no one's ever explained to me in this way, or now I have a better understanding, as opposed to just being told a laundry list of things that I need to do. They now know that this is what I have, I understand my condition, and this is what I want to do for myself. We started Smile and Style 30 years ago as a dream to be able to practice the way we wanted the practice to be, all encompassing of the community that allow us to be raised in this area and be able to offer dental care to all. It's evolved by education, technology, and just being able to know more about dentistry. 30 years ago, dentistry was quite different. And as dentistry is today, we want to continue to elevate and evolve our practice to what we can offer. Because at the end of the day, we want to be able to offer the very best in our education, the very best in our delivery of care through technology, and the very best in our team to overall service our community and our patients. 3D imaging allows us to be able to view the teeth in a way that we've never been able to do. Being able to do that in a model to replicate the patient's bite, and really allows us to better diagnose and be able to present to the patient what's going on that usually they're not able to see just on a black and white x-ray. Photography allows us to not just look at the teeth. Again, we're looking at the overall patient. How does that smile, how does that function affect the entire face, and how does that fit with that patient? So with photography and 3D imaging, that really allows not just us to diagnose and treatment plan better, but it also allows the patient to actually visually see the overall picture of their smile that fits in their life and in their home. Focusing on whole body health is really all about integrative dental medicine. We never see a set of teeth walk in. It's all about overall health. And so focusing on not just what's happening in your mouth, but your mouth is connected to the rest of your body, So it's one of those things that we really do highly stress to our patients, the importance of bringing that all together so that we can make sure that if you want to be a healthy person, it has to start with your mouth, and it doesn't end there either. So it's super important that we always continue to educate our patients in that regard.